or independence from the United Kingdom in 1963. It has an HIV prevalence rate of 6.1%, or about 1.6 million people living with HIV/AIDS. HIV has dropped the life expectancy in Kenya from 64 to 48 years. Only 20% of the people who need HIV antiretroviral medications in Kenya are receiving them. The distribution of HIV prevalence and access to care varies greatly between the different regions in Kenya. Nyanza province is one of Kenya's 8 administrative provinces. Nyanza has the highest HIV prevalence rate in Kenya, ranging from 20% in Kisumu and Migori to 35 to 40% in Suba district. FACES, or Family AIDS Care and Education Services program, aims to work with existing Kenyan Ministry of Health infrastructure to provide the technical assistance and training necessary to bring HIV care and treatment to this region of high need in Sub-Saharan Africa.
FACES stands for Family AIDS Care and Education Services, and it's an HIV program that's based in Nyanza. It began in March 2005, and initially it was started as a PEPFAR-funded care and treatment program for people who are coming off research sites. But very quickly it evolved due to the immense need for HIV services in Kisumu that we needed to expand our services to the general population.
The staff at FACES works hard to build community among the healthcare workers as well as the towns and villages where they have clinical sites.
The main goal that FACES aspires to achieve is to provide coordinated, compassionate, comprehensive care. And the compassionate part of care that we do provide helps us understand that HIV patients are not victims, but they're just as human as we are, and therefore we should treat them as equally as those who are not infected. And in that, HIV in and of itself does not discriminate any racial or whatever boundaries that may exist in humanity. And therefore we should just treat these people just like they are our brothers and sisters. And what we've done at FACES is that we do not call them patients, we call them our clients, because it's for them that we do work, and it's for them that we are all still trying to fight the epidemic and reverse the pandemic.
I joined FACES because I was looking for a job. I was fresh out of college at that time, and also because the scourge has really hit our country. The prevalence is very high, and personally I've lost close relatives to the pandemic, and so I wanted to know that I could be in a position to help these people and also to improve their lives.
HIV/AIDS in that it crosses all sectors, be it medical, be it economic. I decided that I should work with FACES so that I can be able to make a difference. And I can tell you that I don't think there's anyone in Kenya who doesn't know someone, a friend or a relative, who has HIV or who has died of HIV/AIDS.
The shortage of HIV-trained healthcare workers, particularly medical doctors and clinical officers, is a challenge in Sub-Saharan Africa. To address this problem using a public health approach, tasks can be shifted from more specialized to less specialized healthcare workers. Community and clinical health assistants are a cadre of staff who are not specifically medically trained, but are trained to manage clients' psychosocial needs. They provide the very important service of home visits to follow up on clients who have missed appointments, missed medications, or have complex psychosocial needs that require outside community linkages. Community and clinical health assistants also organize support groups and community building events, such as their monthly Kids Club.
Developing leaders, developing people, providing high quality HIV care and treatment to as many people that need it.
Better than you good well. You know better than you good of it. There are needs under and away of my mobile. What the love was under and away of my mobile. Sanda nango tigena